All right, so we are going to go ahead and get started. My name is Gabe Dorn. I'm with Golden Endurance. And today I'm going to talk about the foot specifically, um, kind of the muscles underneath the foot as well as the muscles on top. We're going to kind of keep it to the foot because we've also got a presentation coming up on the ankle. I know for a lot of people that might seem like the same thing, but as PTs, they're two separate things. They're different joints, and we've got a ton of content for both. And so we just decided to break it up that way. This was originally a series that we did at a local running store here in Denver, Colorado. The running store is BP Run Co. They're out of Wheat Ridge, and they're a very, very fun, cool, locally owned trail running store. Um, and they've been really supportive. We've done this whole series where we basically started from the bottom and worked our way up to the back. And so we did the foot, the ankle, the knee, the hip, and the back. And so we did that all in person and had good showing for those. And now we're kind of taking that virtually. And so what we're going to go over today is some basic foot exercises for runners. And these are exercises that hopefully you can take away one or two that may be suitable for you. We've got maybe 10, 15 that we're going to go over. But the goal is not to have you do every exercise yourself at home or give it to somebody, if you're a coach. The goal is really to find a couple exercises that you really resonate with and that you can start applying into your own routine, because we don't want you doing like a 30 to 45-minute routine, like just for your foot, like every day, right? And so we want you to come away with a couple exercises that you can do for your foot to better improve your running, and also come away with a little bit more of an understanding of the anatomy of the foot. Right. So just a little bit more about Golden Endurance. Golden Endurance was founded about a year and a half ago by Sammy, who first took it full time, and we started with the three of us, Sammy, myself, and then Mark. And Sammy and I are physical therapists who also do coaching, and we're coaches who do PT. That's kind of like our tagline, because we try to mesh the two together. That being said, if you're an athlete that you're working with your coach and you like your coach, we don't try to like steal you from your coach. We try to work with your coach, and so we try to really try to communicate with the runner and the coach to kind of give you the most holistic care. And so what that care looks like at Golden Endurance is that we offer strength programming, physical therapy, and run coaching. And a lot of times we'll see somebody who starts in one area and then transitions to another. So an example of that would be somebody who comes in with plantar fasciitis and they're not doing a whole lot of running, but they have goals to race. Then we would maybe start with PT and do a package of PT, and then transition that person to a strength programming routine or a run programming routine. Is where we're programming out like weekly lifts or weekly runs, and trying to kind of progress them back to their goal. We're not your average mom and pop PT shop who gets you back to walking pain free, and we're okay with that. We're really intent on trying to help you achieve your goals as a runner, as an athlete, to really make sure that we're on the same page and talking about what you want to get out of PT. And if what you want to get out of PT is racing 100 miles, then we're going to help get you there. So that's kind of our philosophy. We're very particular about being specific with athletes and making sure that we're treating the individual and giving holistic care. So that's a little bit about Golden Endurance. We also have a clinic dog who you'll hear a little bit in the background. She's moving around a little bit back there. But we have a clinic dog named Penny. And then Mark is not a PT, but he's a great coach who works with us. And he's kind of the third tier of our business. So it's kind of a small outlet, and the three of us, and we like that because we can really take care of the people that we're working with. All right, so today we're going to talk about the foot, and we're going to do a brief overview of anatomy and kinesiology of the foot, as well as how that relates to runners. Common conditions. We're going to go over two common conditions of the foot that we see quite a bit of, and then we'll go over some mobility exercises as well as some strengthening exercises. So just a brief overview of the foot. It's easy to conceptualize it in terms of the top side of the foot and the bottom side of the foot, because you got muscles on both sides. And you can see it's pretty extensive in terms of, you wouldn't think of the top of your foot as having so many different muscles, but there are quite a few. And then there are even more along the bottom. There's about 4 layers of muscles along the bottom of your foot. And so we're not going to go over every muscle specifically. I think it's just easy to conceptualize that the muscles on the top of your foot work to extend your toes, and so that's bringing your toes and your ankle up towards your head. And then the muscles on the bottom of the foot work to point your foot as well as flex your toes. So conceptually, that's kind of the basics, the foundations of anatomy of the foot. And then just looking a little bit at the structure of the foot, this is looking from the inside out. And so you're looking at the inside of somebody's arch here. Structurally, when we talk about arch support or needing shoes that require a little bit of stability, we're really talking about this arch through here. And this is the medial longitudinal arch that's made up of bones and ligaments, but it's supported by the plantar fascia and muscles. And so the bones give it some support, some inert support, and then the muscles primarily give it contractile support. And then the plantar fascia, which we'll get into, provides a little bit of inert support as well. And so there's the arch of the foot. And then we like to conceptualize the foot of having really like 3 points of contacts, and that's your heel, your little toe, and your big toe. And when you run, you if you're doing a traditional like heel to midfoot strike, to even to some extent to a forefoot strike, you're landing on the outside of your foot and then rocking towards your big toe. And so in order to achieve that successfully, you need to have strong muscles and good control of the muscles underneath your foot. And so that's kind of what this is about, is teaching you how to mobilize those muscles and then how to strengthen those muscles. So a little bit on kinesiology. This diagram to the left, the IC stands for initial contact. And so this is for the right foot. The right foot is initially contacting the ground, and then we have mid stance, and then we have toe off, and then we have a swing phase where the right foot is just in the air swinging forward. And as therapists and really as coaches thinking about power generation, we're really talking about the stance phase and running. And the first part of that stance phase is a braking phase, or more of like a force mitigation phase, where the person is landing and trying to take up some of that slack, some of that force of the ground that is exerting on the individual, and trying to generate it through spring tension and elastic energy into a force that will propel them forward. And so that's just a little bit basic kinesiology, and this gets into more detail that, when you're running, you're in the fit stance phase about 40% of this time, and 60% of the time is spent in more or less a swing phase. So initial contact, this is the first part when you're hitting the ground with your foot. You've got certain muscles engaging, and these are generally muscles through the front of your shin as well as the top of your foot that are preventing your foot from just slapping on the ground. And so they're kind of thought as a little bit of braking muscles, but what they're really doing is trying to mitigate the force through your lower leg and then up the kinetic chain. And that's kind of what we're talking about with bottom up, is that the initial contact with running happens at the foot. So we need to have good stability and support there to affect what's happening up the kinetic chain at your knee and your hip. And then, so that was initial contact. Now we're looking at mid stance, and this is where you're starting to see some of the biggest power movers engage of the calf, but also of the undersurface of the foot. And so you've got the heel, and if you're initially doing a little bit of a heel strike to midfoot strike, you're landing on the outside of your foot and then rolling over towards your great toe. And the muscles that do that are kind of lateral stabilizers because they're moving from side to side. And then when we're looking at terminal stance, this is more or less push off, and this is where we get to the gastrocnemius soleus, which is a really big power generator of the calf. But in the foot specifically, we have all of these muscles underneath in about 4 layers that really work to stabilize the arch and provide somewhat of a rigid lever for a person to push off of and propel themselves forward. So I just want to take this time to talk about kind of what we see anecdotally, like what runners come in talking about, and then like what we hear and see at run shops and stuff like that is that everybody's like super concerned about overpronation, and that's like a really bad thing. I think overpronation, how you describe it, can be a bad thing, but it's also a fairly natural thing because at any given time, like 80% of the population are pronators, right? If you want to call them that. And basically, the overpronation is a normal part of the gait cycle, and that's kind of what this diagram is showing here. That you're in foot strike, you're in a supinated position, and then the foot pronates into mid stance, and then it supinates again. And so in therapy, we don't get hung up on pronation, and we don't necessarily prescribe a lot of stability shoes unless we think that somebody really needs it. In therapy, an example of that would be somebody comes in and they have pain in their plantar fascia, and we get them on the treadmill and we see that they pronate on their involved side. And then it's like, hey, wait a minute. What does their uninvolved side look like? And they pronate on their uninvolved side. And it's, maybe a little bit more than normal, but it's not a lot. That's not something that I'm going to get excited about because it's happening bilaterally. And so I don't necessarily need to address it. That being said, if they come in and they pronate on their involved side and the pronation happens at a faster rate, or they stay in it for a longer period of the gait cycle, and that is not the case on the uninvolved side, that's something that I would maybe look at correcting. Still, it's not my go-to. I think there are bigger fish to fry, but then it has a little bit more indication to correct. So I just wanted to address that because a lot of people talk about like stability shoes or motion control shoes and how they have really fat feet and they need that, and that's not necessarily the case at all. So just to go over 2 different injuries that we see with runners at the foot, and really the one that nobody likes and that we see a lot and of concern surrounding our and justifiably so, would be stress fractures, and that's where the bones of the foot are not able to mitigate the forces and they start to develop hairline fractures. And it's not like you fall off a ledge and break your bone. It's chronic, repetitive over time. And so the bone can no longer repair itself, and micro damage has quickly accumulated. A lot of times, especially at the foot, it's relatively easy to palpate, not the fracture itself, but to elicit pain at a very specific point, because it's the top part of the foot, at least, is a lot of skin and bone. And so sometimes they'll have point tenderness, and it's very specific point tenderness, although that is not always the case. And then common sites for a stress fracture would be at the navicular. And that one's a little bit scary because it can form a non-union, and it can be tough to treat and tough to heal. But what's more common would be at the metatarsals. And that is also not fun and a little bit scary, but a little bit better prognostically than a navicular stress fracture. So a lot of this is, we can look at movement and we can look at strength, but a lot of it comes down to load mismanagement. So we see stress fractures in runners who have suddenly increased their miles, who have increased at a or increase their intensity. So like we see stress fractures in runners who have had a sudden increase in volume or a sudden increase in intensity. And it's kind of compounded by what we'll get into in our overtraining series, which is it's compounded by poor energy availability. So a lot of the times it's not just a mechanical fracture, it's that this runner has developed symptoms of overtraining, or like RED-S or female athlete triad, where there are other factors involved, other hormonal, physiologic factors, biopsychosocial factors that would lead to poor bone, poor ability for the bone to kind of regenerate tissue. And so when we look at treatment, we talk about relative rest. A lot of times a boot is not completely necessary, because if you completely immobilize someone, then you're just turning the muscles off, right? And we want the muscles to be able to support the arch to an extent. And so we talk about relative rest and maybe getting them walking, doing some short foot exercises. And we really want to have conversations about load management, because if they've had one stress fracture, their likelihood of having another one goes up. And so that's where you really have to be careful as a PT, but also as an athlete and coach, and really make sure that you're kind of taking a step back and it's like, okay, was there something in the program that caused this to happen, or was it a cumulative load with not enough down weeks that caused this to happen, or is it something related to energy availability? And so that's kind of what we're looking for from a preventive standpoint. And then like treatment is really getting after strengthening some of the short foot muscles that are kind of under the arch of the foot, and then making that more applicable to runners, and really working on power and getting them doing plyometrics and loading the foot again before they're doing some running. And then the other injury that we see a lot of is plantar fasciitis, or plantar fasciopathy, where basically the connective tissue under the foot, plantar fascia, gets inflamed, and can cause like a pain spasm cycle. But I just wanted to bring this up quickly, that it's not just the plantar fascia that gets that can be irritated. It's really the plantar fascia is here on this diagram. This is the left foot, and we're gonna take that away for a second, and you can see all the different muscles underneath that. And so the plantar fascia can get irritated at its insertion typically, but you can see a lot of other muscles come in and attach to that point, and so they can get irritated secondary to that. And so part of what we're trying to do in therapy is to get these muscles moving and to get them engaged a little bit, and to really mobilize through the muscles so that they can better offload the plantar fascia. All right. Now, going over some exercises. We're going to start with mobility exercises, and this kind of helps if you take off your shoes and socks so that you can kind of do it with us. And I'll kind of go through each exercise and then give you a minute or so to try it on your own. And so the first exercise is just a typical plantar fascia mobilization with a ball, and this is fairly common, so probably one that you've seen before. But what this is you're taking a ball, a lacrosse ball or a tennis ball, and kind of starting at the balls of your feet and then working into the plantar fascia. But remember, it's not just the plantar fascia, it's really all those little muscles underneath the plantar fascia as well. And so if those muscles have been turned off due to pain, we're trying to just get them massaged out a little bit to help mitigate some of those symptoms. And so you can try it with a tennis ball, try it with a lacrosse ball, try it with like a Nalgene or even a foam roller. Any of those things would work. But let's just take a minute to go over that. All right. So this next exercise, which is kind of fun, is to work through the muscles of your foot and kind of the muscles in between the bones. And so what Sammy's demonstrating is that she's gone in between the first and second toe, and she's just using her thumb to mobilize through some of those muscles. And she's kind of starting on the inside and working out. You can work in either direction. It's really just finding those spots in between the muscles or in between the bones of the foot, and then mobilizing them with your fingers. All right. So this next exercise is kind of fun. It's taking your hand and going between each digit, and just holding that position, and then grasping your forefoot. So kind of just underneath your toes and moving your forefoot back and forth, and just kind of going back and forth. And what we're really trying to do here is get mobility through the forefoot, but also the midfoot. And this will be interesting. Like some people have very rigid feet, and their feet are rigid because structurally their bones, the joints between the bones don't move as much, whereas other people have very flexible feet. So I'm a good example of somebody who has a very flexible foot, and I can move quite a bit through my midfoot to forefoot. But somebody who has a rigid foot, who has a little bit of a higher arch, may not be able to move nearly as much. And so I would say like this is probably a good exercise for both of those cases for different reasons, right? Like if you got a very flexible foot, you're mobilizing more of the muscles with your hand. If you've got more of a rigid foot, it's still you might not move as much, but you're still trying to get a little bit of mobility through the bones that are kind of forming the joints and articulating in the foot. Right. The last exercise for mobility. Again, this is, you can do this with like a lacrosse ball or a tennis ball or even a towel. But basically what I've done is I've taken my big toe and propped it up on the lacrosse ball. And then I'm just moving back and forth with my knee. And if you do this, you feel a pretty good stretch through the plantar fascia and through the muscles underneath your foot, because you're basically taking those muscles of the great toe and putting them on a stretch. So this is a great, easy exercise for anybody who does have any kind of plantar fascia pain, because it feels good, and it's just easy to do. So go ahead and give that a try yourself. All right. So once we kind of mobilize the foot and get it moving, massage it out, stretch it out a little bit, then we really want to do something with that mobility. And so that's where kind of strength and control exercises come in. So we really want to make sure that we're not just stretching, right? Because stretching is a passive intervention that can be good in terms of managing symptoms, but it's not necessarily making you more resilient. And that's really what we want, is for you to be more resilient over time with your running. And so once we kind of mobilize the muscles of the foot and the ankle, then we're going to go ahead and start to strengthen them. And remember, we're stretching out the big toe because in the gait cycle, about 80% of the force is going through the great toe on toe off, on terminal stance or push off. And so that's kind of why we did that last stretch with the lacrosse ball, is to kind of work on those muscles. And then what Sammy's going to demonstrate in this first video is just kind of mobilizing that toe and doing some isometric holds with it. And so what she's done is she's got her great toe propped up. If it'll load, there we go. She's got a great toe propped up, and she's just taking her hand and applying some resistance first to the bottom and then to the top. And she's doing 5 to 10 second holds in each direction. And so isometrics are a great way, especially if a muscle has been turned off, to turn it back on. And isometric is just a fancy word for a hold. And so she's just holding a position for a longer period of time and resisting with her muscles. And she's doing that both for the muscles on the bottom of the foot, when she's pushing into it with her great toe, and then she's doing kind of opposite on the muscles at the top of the foot. So go ahead, give that a try yourself. All right. So a really fun exercise to try would be toe yoga. And the first part of that is toe splaying. And so what we're doing here is I'm taking my toes and lifting them off the ground and then reaching them out. So I'm trying to space them apart and then setting them down. And then relaxing, taking my toes, lifting them up and spreading them apart, and then setting them back on the ground. And this might be easier if you lift your big toe, but for a little bit of an extra challenge, you would do it keeping your big toe down, because those are separate muscles. So you're lifting your lesser toes up, spreading them apart, and displaying them out, and then setting them on the ground. And this is to get all the muscles moving that you kind of mobilize when you're massaging through your hand or your foot, excuse me, when you're massaging through the muscles of your foot. Those muscles between the bone work on splaying your foot and splaying your toes. And so first we mobilize those muscles, and now we're working on actually engaging them and strengthening them. All right. So for this next exercise, we're going to work on doing the opposite in terms of moving the big toe. And so what I've done here is just put a pen for a little bit of reference or cueing between my feet. And then I'm taking my big toe and bringing it in towards the pen, and then bringing it back out. And I'm doing a much better job on my left than I am on my right, but I'm trying to keep my lesser toes quiet. And so we don't want a lot of movement in the lesser toes, because we want you to be able to move your big toe independently of your lesser toes. And what we'll see with somebody who comes in who has pain is that they're really not able to do that at all a lot of the times. And they're just really not used to isolating those muscles. And so that's partially what we're trying to do in therapy, is to get them a little bit more independent and isolating the muscles of their foot. And for this exercise, as you're trying it, you might feel a little bit of engagement on the inside of your arch. And that's because that's where that muscle belly is. And so the muscle belly that moves the toe inward like that is on the inside of your arch. And so it's also a pretty important muscle. Your abductor hallucis is a pretty important muscle for supporting your arch, right? It's not just, like we said, it's not just your plantar fascia that supports your arch. It's all the itty bitty muscles in between the plantar fascia and the arch itself, or the bones themselves. All right. And then this last one on this page is toe yoga. And it's kind of everyone's favorite because you can do it all day long. It's fun to do. It's got a fun name. But you're basically working on lifting your big toe independently back and forth. And this is kind of what I was touching on earlier, where we're trying to get you to learn how to disassociate your muscles and move them separately. And then, like, part of what we do in therapy is teach you how to move them separately and then combine movements over time that become a little bit more functional with running. And then once you've done your lesser toe or your greater toe, I want you to try to work through and move your lesser toes up and down and keeping your greater toe quiet. And so we're not moving through our big toe now. We're trying to lift our lesser toes off the ground. And then if you really want to get fancy with it, you can try alternating. And that might take a couple weeks to really get up to that point. But you can try lifting your great toe, setting it down, lifting your lesser toes, and trying to keep your toes relaxed when you're lifting the other one and not necessarily letting your toes crimp or grab. We want to try to keep everything relaxed or quiet when we're not using it or not moving it. All right. We got a couple more exercises we're going to go through today. And these are becoming a little bit more functional in terms of we're doing a little bit more standing, a little bit more resisted exercises. They're still relatively basic. The goal of today is not to go through like a whole therapy progression. It's kind of to give you some of the fundamentals in terms of moving your foot and your toes and kind of developing some strength in the arch. And so this next exercise is taking you through supination and pronation. And like I said, so pronation is where the arch is coming down. Supination is when the arch is coming up. And what you can do is stand up with your shoes off and rotate your shoulders to one direction, and you'll see the opposite arch drops into pronation, while the arch on that side, on the side you rotated to, supinates, so it gets higher. And I'm a great example of this because I have very flexible feet, so it's pretty obvious to see that as I twist that side, I'm able to supinate and develop a higher arch. And then when I twist away from that side, that arch drops down. So somebody who has very rigid feet, this exercise still might be appropriate. You're just not going to see as much movement with that. All right, I think this next exercise is just for a lot of people, just a really necessary exercise that they can take away from this little webinar. But it's working on lifting your arch. You're doing an arch lift. You can do this with or without a band. I'm using a band because it is a little bit more resistance. But what you're trying to do is from a flat-footed position, take your arch and just lift it up off the ground. So take the inside of your foot and just lift it up off the ground. And what we're trying to do here is to use your muscles to support the arch and not have the arch rely so much on the plantar fascia and the bones surrounding the arches to get the muscles engaged. So you can also take your hand and kind of feel that yourself. And you know you're doing it right. Even if your arch doesn't move a lot, even if you've got a relatively rigid foot, you'll know that you're doing it right because you'll feel a contraction in the muscles of the arch. And so just going back and forth like that, holding for a couple seconds. Now the band, as you lift, you're kind of pushing your ankles out into the band. So that's providing a little bit more resistance. But for starters, or if you don't have a band, it's fine just to work on contracting your arch and then relaxing your arch. And if someone's having a really hard time with this, I would maybe start them sitting down so that the weight of the body is not necessarily a factor and that they can really focus on just contracting the muscles underneath their arch. And we want to do this with relatively quiet toes. And that's part of what we were working on with toe yoga is learning how to use those muscles, engage those muscles, but then turn them off. And so when you're doing this, you want to try not to crimp your toes or grab the ground or try not to extend your toes, lift them off the ground. You want to keep them relatively quiet and just move through the arch. It's almost like you've got a credit card under the ball of your first toe. You're taking that credit card and just pulling it back a little bit towards your heel. And that's all you're doing. But this is a little bit foundational in terms of you think about core for your back and developing muscles around your spine and your core for your back. This is kind of like that for your foot. Like an arch squeeze is kind of like a crunch up for your foot. All right. This next exercise, we're working on using our big toe to push into a band or to push into the ground. So if you don't have a band, you can just push your big toe into the ground. But again, we're trying to just move through your big toe and not move any of your lesser toes. And so we're trying to do this to get good strengthening through that first toe. Because like I said, about 80% of your body weight when you're pushing off, when you're running, goes through your great toe. And so we're trying to isolate that and really work on getting those muscles, specifically that houses the flexors of the muscles underneath the great toe to get engaged. And you'll feel that not just like through your foot, but you also feel that in your arch, right? And so those muscles also act to provide a rigid lever for you to push off from your arch. And so this one, these toe exercises, they don't seem as important, but they really are important for generating power in your gait cycle. And keep in mind, they're still relatively basic. So what I would do as a therapist or as a strength coach, if we're trying to progress things from a strengthening perspective, is start with this exercise and then maybe have somebody do it standing on one leg, and then have somebody do it in a terminal push-off position where they're kind of leaning forward and up on their toes on that side. And then maybe even cue that on the treadmill running. And so this is like the starter exercise for a larger progression that I would do with a patient. And this is kind of the same thing, but isolating the lesser toes. And so you can do this with or without a band, but you're basically taking your lesser toes and trying to push them into the ground. And we don't want to grip or have your lesser toes crimp. We want them relatively straight, pushing into the ground. Because a lot of runners, and you can try this on your next run, you might feel yourself gripping through your lesser toes like this, and you're really just using one muscle, and that's okay. Not necessarily, it doesn't necessarily mean that you're gonna have pain because you do that. It just means that you're not effectively using your toes as a rigid lever to generate force and push off and control. And so this exercise, I've got a band around my lesser toes and I'm just pushing down into the band, trying to keep my big toe quiet. All right, so that kind of sums up the foot and the toes and the arch of the foot. About a month from now, we'll do another webinar on the ankle, and then a month from then, we'll do a webinar on the knee and the hip and the back. And so that's kind of what our summer series looks like. For the bottom up series, we've also got other webinars going on. Overtraining for the endurance athlete starts next week, and that's really a series that if you're a coach or if you're an athlete and you're not necessarily trained as a physical therapist, it's like, what can you do to avoid some of these injuries from a loading perspective? And so it's really looking at overtraining and how that affects injuries that we see in the clinic. Because like I said, like, part of what we do, we're movement scientists as physical therapists, and we work on correcting movement and strengthening from there. But a lot of it, at the end of the day, it comes down to load and load management. And so that's really what that overtraining series is about. We're really excited about it. I think it'll be a lot of fun. Hopefully we get a good shine for that. Like I said, we're also doing a webinar on the ankle. It's already on our events page. So if you go to golden-endurance.com and you like this webinar and you want to sign up for the next one, it's under the events page there that you can register for. And then we're also going to be at the Great Divide Ultra. We partner with Revenant Running, which is a great local outlet here in Colorado. This is their only race this spring, but then they're doing 3 or 4 races in the fall. And we show up there as physical therapists and provide like post-race sports massage to runners, and it's a lot of fun. So if you're looking for a trail race, they're a great company to support. They're super local, and we really appreciate it. If you like this webinar and you want to get in and talk more about this in person, we're happy to do that. We're happy to do phone consults to see if you're the right fit for us, and then from there decide if you need to get into the clinic. If you do decide to come into the clinic, you will get 50% off your initial PT session, or if you're signing up for strength, you'll get 50% off that first month for strength and programming. And so those are kind of what we're pushing this summer. We got a lot of great things down the pipeline. Really appreciate everybody for registering for this webinar. Hopefully you got a lot out of it.